As we mentioned at the top of the newscast, temperatures are starting to cool, so we all know what that means. It begins the start of flu season. However, this year, Midlands doctors are warning about an increase in the number of RSV cases. That's what's causing them real concern. News 19's Nate Stanley has more on how you can keep your children safe.
We're full to the max across the state, so it is definitely a statewide issue.
A stark outlook at hospitals in South Carolina, according to Prisma Health pediatrician Anna Catherine Birch. She says the state is currently seeing an increase in cases of respiratory syncytial virus, known as RSV, in young patients. According to Dr. Birch, right now in the Midlands, the virus is more active than the flu or COVID-19. She spoke about the symptoms you should look out for in young children.
So if you are seeing any kind of extra breathing, if you're looking at the ribs and you're seeing the skin going in and out between the ribs, the respiratory rate is so much that we're at, 50, 60, 70 times a minute.
If you see those symptoms, she says to take your child to a physician or emergency room. Parents are on alert too. Madison Beeman is a mother of a 4-month-old.
I tell everybody, even family, don't kiss her on the mouth if you can avoid it. I mean, she puts her hands in her mouth, so try not to kiss her hands.
Donna Martin is a mother and grandmother. She says her grandson was hospitalized as a baby with RSV.
I'm concerned, and I do everything to keep myself and my family safe. I just advocate hand washing and not picking up stuff and eating it off the floor.
She says the fall season makes her more mindful of her family's health. Dr. Birch says parents should be on lookout but shouldn't be fearful. Some of the most effective ways of limiting the virus are simple.
Good hand hygiene that we've been preaching for the last 2.5 years, coughing or sneezing in your sleeve, and that you're using very good hygiene afterwards, hand hygiene afterwards. Making sure that we're getting our yearly flu vaccine. Right now is the time to get your flu vaccine.
As we head toward flu season, Dr. Birch says that shot is crucial for preventing multiple infections. Beeman says she and her husband are limiting who her baby is in contact with and are preparing for when, not if, her baby eventually gets a cold.
I don't want her to be hospitalized or anything.
In Columbia, Nate Stanley, News 19, WLTX.
Dr. Birch adds the timeline for RSV is like any common cold or flu, and she encourages you to see a doctor if the symptoms last longer than a couple of weeks.